Hello, everybody. I'm Dr. Usama from National Medical Research Center from the Libya, Zawiya City. First, I will give you the introduction for this national center. The National Medical Research Center is one of the research center affiliated with Natural Science and Technology Research Institute. The center is located in the Zawiya City. Zawiya City is near from Tripoli City. The center counted many research in the medical. Okay. Okay. Good. Okay. The center many research in the medical and food field that are interested to Libya in general. The center has 7 branches in the south and east of the Libya, Benghazi, Sirte, even Sabha city. The management of the research serves from the important department in the counting in the term of the direct supervision laboratory and follow-up work and maintenance of this device, and also interested in the provision of operational material. This is the picture of the National Medical Research Center. This is the laboratory, biochemistry laboratory, microbiology, serology, pharmacology, and toxicology also. And this is the animal house in the center. Before 4 months back, we start with my team, about 30 persons, divided between doctors and nurse and medical research and technician to work this work. Survive for communicable disease among immigrants in western region of the Libya. This is Zawiya city and the Tripoli city, Al-Khoms city, also the western Libyan city. Healthcare assessment, methodology, development of the draft basic package of the health service for surveillance, control, communicable disease at immigration camps. The team doing the assessment will visit the facility and the collected all relevant data using a questionnaire which will be filled by the investigator with inputs for local manager by direct inspection and processing all relevant document. Interview various staff member, interview with person and their relative, clinical examination, and given the treatment as soon as possible. Laboratory, the mean blood investigation for the viral screen, for the complete blood count, CBC, and also liver function test, renal function test, stool analysis as dependent of the case, especially in the children, and urine analysis for culture and routine. Also antenatal care, labor and delivery, postnatal care, and care of the newborn. Communicable disease like TB, leishmania, AIDS, and also hepatitis, malaria, meningitis, and typhoid. Child health care, expanded program immunization, service routine and outreach. Growth monitor and child curative care. General immunization service, typhoid, influenza, and school children. This is the list of the main campus present in the western city in the Libya. About 10. There is another campus, but this is the main. Zlitan, Al-Sikka, Al-Khoms, Salah ad-Din, Al-Nasr, Abu Slim, Surman, and Zwara. This is my team, and we work to visit this campus. We started before 3 months back. We visit this campus and take an investigation from the African immigration people, and clinical examination and collection the data. This is the picture of the one of this campus. This is the data of the result investigation. We collect the name, age, nationality, from the different nationality. Organization, this National Medical Research Center, National Office of the European Program in the Higher Education Libya, University of the Zawiya Libyan and Red Cross Society, and Zawiya Ministry Health, Civil Community Organization. Thank you.
Thank you very much. Do you have any questions, Iro?
Thank you very much for your participation to our workshop and for the presentation. So the main question that comes from my side is, what is the situation in the camps in Libya, where you've been there? What have you seen? What are your...
Okay. Dr. Mohammed, sorry, do you mean they ask for the situation of the camps?
Yes, what is the health situation in the camps, the general situation for the migrants and refugees there?
Okay. When I visit these camps, there's the situation is very, very bad, because there are a lot of the people present in this campus. I mean, no health care, no any medical treatment taken for this patient, no vaccine for the neonate or the newborn. I see there is many pregnant lady was delivered in this campus, but no health care, no post-antenatal care, no any vaccine for the newborn. So some patient taken a treatment, maybe transferred to the hospital, but these cases, emergency case, only the emergency case. The another people cannot take any treatment. When we started for this work, we given some treatment for some patient, but not all. At this time, we see 2 patients suffering from the dry cough for 6 years back, the sinus and symptoms like TB. When transferred to the medical center for the infectious disease in the city, there was 2 cases of the TB, respiratory TB.
Any other questions? Nabil?
I'm also from Libya, although I didn't conduct any research in this relation, but I have the general idea regarding Libya. In Libya, it's almost failed health center for the Libyans ourselves, for my family, because the WHO report, I don't know if you check that one, found out that almost only 20 or 30% of all the health services are functioning up to some 70%, not even perfect. So imagine what is happening there. So it's actually, and even this burden of thousands or hundreds of thousands of immigrants, which are kept in some controlled camps by the government, some are just by militias that uncontrolled. And so it's an issue. International community trying to help, WHO, IOM, MSF, also they are even sending some patients from these camps to Tunisia for, which is the usual and what's the Libyans do actually. Even if you have some complaints, they will go to private hospital, then the next day the family will take him to Tunisia for that. So we need to have some, because you know, when we're talking about the support from international societies, IOM and UK, EU, they start arguing with, for example, where I work with the National Center for Disease Control, And I don't know how they can give this support, financial or by technical or sending doctors. Or so they are starting to find some way or to connect this efforts together so that the benefits goes to the people who needs that. And hopefully that will come also for the Libyans, because you cannot provide help to camps and then omit the country itself. So thanks a lot for my colleague, which I met him just today, to be honest. We should supposed to come together. But what he presented is just to give you the idea that we are, as national, trying to help, but we cannot do that without the help from the international. Thank you very much.
Thank you for the presentation. I don't know, it's for colleague and colleague here. Doctor, is it the issue of security that there is no access to health services or not allowed to organizations to come to Libya and work? Is it security is main challenge, Doctor? Is the security is the main challenge?
Yes. Yes.
It's okay. Yeah. Yes. It's for you.
You ask for the security of this campus or for?
Yes, this is one of the issues. When I mentioned that not most, at least some of the camps are controlled. I mean, one example is just last week there was a fight between the government army with some militia in one city, and when they get rid of that militia, they found that they were keeping almost 5,000 migrants. They took them and started to spread them. If you know about Sabrata city, that was in the news. So it's an issue, of course. Number one is the security. And I know your question, you are trying to ask if the international society can send experts. This is also an issue. Although, I mean, for the last, I think, year, they started to show and to come from MSF. I've met myself 2 or 3 times, and IOM, and so it's an issue, but started to getting better, hopefully, in the western part.
As I think you're aware, there was this agreement between Italy and Libya that actually came in June, July, something like that. That from the data that I showed yesterday stopped completely the immigrants coming to Italy. And actually there is a strong movement in Italy that is ashamed of this, because it's putting the burden of immigrants coming from Sub-Saharan Africa on a country that is much poorer than us, and so requiring really efforts from a country that has a civil problem and is poorer and so on. So really myself are ashamed, but there is a large movement, NGOs and so on, that are against this agreement. Did you already seen effects of this agreement in terms of numbers of people that are stuck in Libya, and consequences also in terms of health, or you're not aware of any?
Would you like to comment on that? Has the situation worse in the last months or not in the camps with more?
Yes, every day they worsen more than last year's and last month.
One last question.
Yes, thanks for the overview in your presentation. I wanted to ask a question in scope of that we're here with so many public health professionals. Like, could could you specify what type of specific needs would have highest priority at the moment? And I can imagine that your answer is everything, but because, you know, yeah, like you said, the situation is very dire. But since we're here with so many people, you know, I would be very interested to see what the needs are. I mean, we can wait for governments, of course, to react, but a lot of us can, for example, also directly assist you, for example, technically on many things. So do you have like a brief outline of the direct needs in terms of capacity building, for example, training, things like that?
Yeah, I can say, I mean, as I tried to show the picture, I can tell you, okay, you start from assessment. So it will go finally like a project-wise. I mean, you start with situation assessment, what are the diseases, what are the needs for the migrants, and then you see what you can offer to them outside these camps, because as I told you, it's almost failed health system in Libya. So it's a kind, and that's the dilemma I think, because if you see what international society trying to offer and meeting with people from Ministry of Health, from in CDC where I work, they try to help, but then they find that it's like a vacuum. Where should we start? Where? So I cannot answer that, but I can say it should be some technical assessment and supply and support the country itself to solve its problems so the health system can start again. So it's a difficult question for myself, to be honest.
So thanks a lot to Dr. Usama.